Good evening, and thank you everyone for joining, and welcome to our program, Community Resources for Families of Young Autistic Children. I'm Michael Morrier, and I'm one of the board members of the Atlanta Autism Consortium, and currently work on their programming and fundraising committees. And part of the exciting work I get to do is put a panel together like this and get some resources out for everybody. For those of you that are new, the Atlanta Autism Consortium is a nonprofit organization dedicated to creating, collaborating conversations throughout the metro Atlanta area, autism community, and beyond. We host free programs just like this on a variety of topics, and we're so glad that everyone has come to join us. Before we get started, just a few brief housekeeping notes. Please know that as attendees, your microphone and camera will remain muted, but you can ask questions you have throughout the program in the chat box at the bottom of your screen. After each presenter, we'll have a few minutes to go through the questions. Any questions we don't answer at that point, we will give time at the end. Additionally, we will be emailing out the contact information of our panelists to the email address you use to register for the program, so that you can contact them directly with any other questions you might have. Tonight, we are very excited to be joined by Synita Griswell from the Georgia Department of Public Health, Leah Hayter-Bardo from the Georgia Department of Behavioral Health and Developmental Disabilities, and Doctors Nicole Hendricks and Catherine Picard from the Marcus Autism Center. I just want to also add, in case they don't get to it, but I hope they do, Dr. Hendricks and Picard are the founders of a new resource initiative for families and individuals with autism called Partnership for Autistic Acceptance and Knowledge, or PEAK. Hopefully they'll have time to give us some information about that new initiative today and what they've been doing and what to look forward for in the future. So without further ado, we'll get started with our program. Our first presenter is Synita Griswell from the Georgia Department of Public Health. She received her Master's of Arts degree from Florida International University, and currently she's the Program Manager of Autism and Developmental Disabilities at Georgia's Department of Public Health. Previously, she was a Program Coordinator and Supervisor at DPH, and also held positions at Children's Home Society of Florida. We welcome her knowledge and insight into the DPH statewide initiatives on autism to help children receive regular screening, identification, and support through the Babies Can't Wait and other statewide programs. Go ahead, Synita, welcome.
Awesome. Thank you, Michael. And thank you all for being here. And I'm really grateful for this opportunity to share some of our work at the Georgia Department of Public Health with you, and hopefully provide some useful resources for the families that you service or for your families likewise. So again, my name is Synita Griswell. And as Michael mentioned, I am the Senior Program Manager for our Georgia Autism Initiative, also focusing on behavioral health and development. Okay, so brief overview of what we'll have an opportunity to talk about today. We'll share our federal health objective, which outlines our overall state program. We'll take a brief look at the health burden for autism in our state. And then we'll also talk about the referral process for accessing some services that have helped a number of families into early intervention and early identification. Then we'll wrap up with some of those program services and activities, so what the referral will lead families to. And then finally, we'll be able to highlight some of our internal and external partnerships for you guys here this evening. So to begin, I'd like to share that our program is a federally funded program in part. And with that partnership and that funding, it's our goal and objective to operate by the Healthy People's 2030 Health Objective, which states to increase the proportion of children with autism spectrum disorder who receive special services by the age of 4. So why might this be really important for us is because we understand that the earlier we are introducing children and families to services, the better their outcomes become. So the better we're able to support their individualized needs and get them some services in place that help them with developing those skills and really just highlighting their strengths. So the prevalence of autism, as you can see over the course of a number of years in the US and in Georgia, has increased. So currently, the CDC reports 1 in 40 in Georgia have been identified or will go on to be identified with an ASD diagnosis. And this is among 8-year-olds. So as you can imagine, with this number increasing, a lot of times we'll receive questions just wanting to really understand, the reasonings for the prevalence increase. And while some of this is unknown to us because it's still sort of like being researched, and there are a number of things about ASD that is unknown to us. We do know that we have gotten better with identifying autism in children, and also some of the criteria for autism has changed in a sense of it has sort of broadened what falls into that category. So again, just kind of giving us an overview of the magnitude and the impact that we're working with and the families that we're able to see. So if you're thinking about, per 1,000 children, you'll likely see that 1 in 40. So again, I'm here to really share about this program that I have the pleasure of overseeing at the Georgia Department of Public Health, the Georgia Autism Services Initiative. So what is this initiative about? And we define this initiative as a service delivery system to improve Georgia's capacity for early identification, screening, diagnosis, intervention, and transition planning for children birth to 21 years of age. And it's really important for us to highlight that we began to implement services in our Part C Babies Can't Wait program in 2019. So these are still fairly new services that I'm going to highlight for you all this evening, but we're really pleased at the progress we've been able to make thus far. I also like to highlight that our public health districts at the Department of Public Health are broken up into 18 local offices that cover the entirety of the state. And that's depicted on the screen here. So depending on where you're located will essentially determine which area of the state and which public health district that you're assigned to and therefore can access these services from. So what are early intervention services? This is a list of our early intervention services. So children birth to 3 can receive access to these services. Some of those include assistive technology, audiology, behavioral intervention, which we'll talk about a little more, evaluation and assessments, which are free at cost for children and families as the program serves as a pair of last resort, health and medical services, as well as nutrition services. Some of our primary resources that families access are the physical, occupational, and speech therapies. And then there is a component that we identify as service coordination, which really wraps the family around with these supports and ensures that based on their evaluations and assessments, families are linked to those individualized supports and services that will best meet their needs. So that's our service coordination. And then again, we're going to talk a little bit more about the behavioral intervention piece. So ASD early intervention services, as I mentioned, these services are individualized through an IFSP. So that's an individualized family support plan. And this this plan, CARE recognizes and respects the pivotal role of families in the lives of their children. So these services are family centered and caregiver centered, understanding that a professional can go into the home only so many number of hours during the week. However, that parent is there consistently, that caregiver is there throughout the week and can impart a lot of those skills throughout that daily routine, in that natural environment. So really generalizing what the professional may go in and demonstrate for the family. And so that family or caregiver can then impart those skills and help the child develop those strengths throughout their day-to-day natural environment and their day-to-day routine. We do have the option to contract with board certified behavioral analysts. And in a number of our districts, there are behavioral analysts that are available to our families. We try to create this as a service that is across the board. However, we sometimes might run into sort of capacity challenges. However, once you're linked in with that local public health department, that district will work and do everything they can to help a family locate this service. So referrals, how do we receive referrals? Referrals can come in through a number of different channels. Parents can call in to one of the local health departments and make a referral themselves. Oftentimes, we'll receive referrals from pediatric practices or from a child's primary medical provider. And to initiate that referral, we use a form that that is assigned to our central point of entry program. So our Children's First program is our central point of entry program, and infants birth to 5 can access this service. See First will really essentially triage the child and the family. They'll look at that referral form and they'll determine what are the needs, what's the demographics, what's the child history, and then they will determine all of the child health programs that the family is eligible for and they could benefit from, and then they will make sure the referral gets to those programs. So referral happens, again, it can come from a number of different sources. It can be parent report, it can be from a education system. It can also come from a pediatric practice. They will use the same form, which is the Children's First form, and Children's First will then get the child and family to programs like Babies Can't Wait and a number of other child health programs. Another cool thing about Children's First is that they will offer a ASQ, so to really determine the child's strengths and some of their challenges in areas like social emotional development, communication, and things of that nature. So here is just a sort of small visual of the Children's First referral form. However, I will share a link before the end of our time together this evening where you can fill this out electronically and send it directly to the district program that is servicing your areas. So this is just a visual of what that form will look like. So Ages and Stages Developmental Screening is one of the screenings that we offer once a child and family is referred. Again, that can come from a primary provider. Well-child visits for all children should include developmental monitoring. However, we do serve as a bit of a safety net, especially for those families who may not be linked in to receiving that primary care from a physician. Another service that we offer is ASD-specific screening at 18 and 24 or up to 30 months of age. We utilize the MCHAT, which is a pretty common widely used screening tool, about 20 questions, and it's also parent report. So that screening tool will essentially help us to determine what are some of those next steps related to children who we suspect might be on the spectrum. And then that will also help us to determine what resources are available for diagnostic evaluations. So again, if delay is identified or suspected, we really encourage families, providers, education systems to refer for further evaluation. If there's any concern, it's best to make that referral so that we can determine what might be happening with the child or family. So here I'm going to highlight a couple of our diagnostic evaluation pilots that are happening in a number of districts throughout the state. So we are in partnership with Emory Autism Center that facilitates a diagnostic pilot that we term the Early Diagnostic Response Model. What's really cool about this pilot is that it is 100% remote. So especially for those areas where they may struggle with having local providers in their area, this has really helped us to inject these services into especially rural parts of Georgia, and to help us help families receive a diagnostic evaluation that is quite comprehensive and that can help them gain access to behavioral intervention services. So currently this pilot is being hosted and facilitated in Dalton, Dublin, Waycross, Rome, Cobb Douglas, and Albany. And since these slides have been created, we've actually added maybe one or two districts that are new in the process, one being Columbus, Georgia as well. So the early diagnostic response model process. Here is just a brief kind of visual of those steps that a family would participate in order to receive this diagnostic evaluation. So because this is a pilot, families have the option to opt in, or they can, of course, decline to have a diagnostic evaluation this way. So if families agree, they are contacted by Emory Autism Center to set up that meeting to review informed consents. And this does happen via a HIPAA compliant, actually WebEx platform. So within that process as well, families, they will review it and sign the informed consent, and then a electronic intake form is sent and it's completed. Once that is completed, Emory Autism Center will contact the family to schedule an assessment and feedback. And then, of course, if the family declines not to participate, Emory Autism Center provides referrals to GAC providers. And this is a number of licensed community psychologists positioned also throughout the state of Georgia who have been trained on some of our gold standard diagnostic tools, including the ADOS. All right, so we've talked a little bit about the first two steps, right, in this process of after early identification. We talked about screening at the 18 and 24-month intervals. We've talked a little bit about diagnosis and some of those solutions that we've leaned on in order to support our children and family across the state who we suspect to go on and have an ASD diagnosis. And now want to highlight a bit about behavioral intervention. I mentioned that board certified behavioral analysts can contract with the Part C program and service our children and families once they've received a diagnosis within that Part C program. And we also have a group of parapros called special instructors who deliver evidence-based informed strategies that address social emotional needs and development to include some of those strategies being Autism Navigator, Project Impact, which I believe Dr. Catherine Picard and Nicole Hendricks will talk about this evening, and then also the pyramid model. So we really try to wrap our families around with some general sort of social emotional strategies that can also service children and families with autism. And now I just want to share a bit about our transition supports. So transition planning from Babies Can't Wait may begin at 27 months, but no later than 33 months. And transitioning meaning going into the community or preschool intervention programs, also Head Start, childcare, private therapy, private preschool, as well as other community activities. So we do help our families transition prior to, we help our families transition once they're exiting the Babies Can't Wait program at 36 months. So it starts, it can start anywhere between 27 months and no later than 33 months. Right. So just to highlight some of our internal and external partners whom we could not do this work without, I've mentioned Babies Can't Wait, but I have not highlighted Children's Medical Services. That is another great program and resource that families can access through that central point of entry program, and that being Children's First, Help Me Grow. And then, of course, have to thank our epidemiology team for really helping us compile a lot of the ongoing data that we learned from. Our external partners do include many that are represented here on the call today. This is not an exhaustive list, but have to kind of commend our partners at Emory and Marcus Autism Center, as well as DBHDD in the Department of Education, and the American Academy of Pediatrics. So now I just wanted to share a couple of resources. We talked about the MCHAT screening. Again, this is a parent report. So if you are interested in kind of, looking at these questions, kind of understanding what to look out for, these are some resources that you can access. And there are a number of different language translations at the at this web version here. Also wanted to highlight parent academies. So this is actually through our partnership with Georgia State University, where children between the ages of 3 to 5 can, so the caregivers of those children can receive some individualized training to address persistent and challenging behaviors of their children. And then here is a link to our transition toolkit to help youth and young adults transition into young adulthood with greater ease through our individualized transition assessment plan program. And that concludes the information that I have for you this evening. I will actually include another link to our Women's Children Nursing Services locator in the chat. And that will actually take you to the specific district based on the map that I showed earlier of the entire state. So that will be a really great resource for everyone, hopefully here this evening as well. Thank you.
Thank you very much, Synita. Just a couple of questions that came through while you were talking. One was, which you kind of answered, will a copy of the Babies Can't Wait district map be available so that people could give it to families that they're supporting? And where else could they find it besides your slides? You're on mute, sorry.
Yes, this link that I'm going to share in the chat, I think will be most helpful to share with families. A lot of times we're doing things electronically, but there is actually like a visual map at the link as well.
Okay. And then couple of families asked about a family that received a diagnosis outside of the United States. Can they still be referred to Children's First and Babies Can't Wait?
Yes. Great question. And absolutely. So as long as they're within that age range, they can still be referred. It would actually help for them to bring that evaluation with them and perhaps like attach a copy with the referral, even if that evaluation has to be completed again, it will help us to determine the child history and just how to move forward. So yes, I would still
Okay.
refer that child.
And then someone else was asking, they have a few families that are having difficulty getting Babies Can't Wait to speak and share information with the public pre-K system. So do you have any advice on how they can support families with that transition when they turn 3 and the Babies Can't Wait people in school districts never connected?
Yeah, so I would recommend communicating with that child or family's service coordinator first. Service coordinators are actually the ones who organize those transition meetings, and they are typically really vital. They can participate in those meetings. A lot of times, families will invite the service coordinator to those meetings. And then, if that is not as fruitful, I would encourage a family or provider to work with the early intervention coordinator in that district and have them get involved so that they can also identify someone who could participate in those transition meetings.
Okay, and then a couple questions about the EDRM process.
Yeah.
One, I think I did answer, but just to double check with you, if someone is in the pilot project or pilot region, are they all referred to the EAC for the evaluation, or is it just those that the parents have consented on? And how long does that process take?
Great questions. So, if you're in that pilot region, not everyone well, I'm sorry. Anyone can be referred. Any family or child can be referred with that concern on the MChat. And each family has the option to consent or decline. So the referral is sort of triggered by the MChat and being in that pilot district. In terms of the process, we've actually had a lot of success where we see the entire process completed within about 4 weeks. Sometimes a little less, maybe a little longer, but no more than about 6 weeks. So it depends on the scheduling that everyone's able to commit to.
Okay. Thank you. And then someone else had said about the Babies Can't Wait in school district not talking, that the family could also contact preschool special education coordinator at the Department of Education to get the school system contact to talk.
Yes, that is a great solution. Yes.
Okay, thank you. And if you have any other questions for Synita, we'll have some time at the end as well. So I want to just move on to our next presenter, Leah Hader Bardo. She is a Georgia native. I think she's the only Georgia native on this panel that I can think of. She holds a bachelor's of science in psychology from Emory University, as well as both a master's degree in special education that had a concentration in autism spectrum disorder and a master's certification in public health, both from Georgia State University. Go Panthers, that's where I got my doctorate from. I know there's other people from GSU here too. Her professional experience includes working as a behavior therapist with the nationally renowned May Institute. She has over 15 years of experience in both the public and private sectors, providing services and supports to children and adults with autism and intellectual developmental disabilities, as well as engagement of community-based services. And she is going to talk about how the Department of Behavioral Health and Developmental Disabilities, or DBHDD, can help support families as well. So thank you for joining us.
Yeah, thank you. I'm really happy to be here, and thank everybody for attending. Let me cue up my slides really quickly. I am here to talk about our services for primarily our services for youth on the spectrum. And then I'll add a little bit at the end about our waiver services as well. So I am the Autism Project Manager at DBHDD. I oversee our crisis response for youth on the spectrum. And we have three main service lines for crisis services. One of them is intensive in-home, which is not limited to youth with autism, but they are included in that population. So I'm adding it into this presentation, as well as our ASD crisis homes and our ASD crisis stabilization unit. I'll go through all of these in more detail in the next slides, but I really want to emphasize that all of these are typically accessed through mobile crisis referrals, and that starts with a call to 988. So anytime if there's a crisis of any sort, behavioral, mental health, please, for your child, for yourself, just going to put a plug for 988 out there. It's a really wonderful service. So our intensive in-home services, they're designed to do just that, allow the individual to stay in their community. The last thing that we want to do, taking a child, especially out of their home and their community, is absolutely a last resort, which of course can be needed sometimes. But this intensive in-home allows the individual to stay where they are and have clinicians come to them to provide supports. It's intended to last for about 7 days. It's really more of an average of 7 to 14. But this service is for clinicians can come in and assess what their needs are. It's really intended to primarily support caregivers in terms of providing them with access to resources. If there is already a behavior support plan that was written by another BCBA at their ABA provider, or if they were in a facility in the past, they can retrain or continue training the parents on implementing the caregiver on implementing those plans. And they can also suggest some environmental modifications, things like adding additional locks, specifically what to look for, alarms on windows, things like that. So it's really meant to support the caregiver to allow that individual to remain in their home. And in the event that the child is not safe at that moment in their home, we have a few options for some short-term out-of-home placements. And one of those is our ASD crisis support homes. So we have two right now. They have 3 beds each. They're located in Kathleen, Georgia, and Jonesboro, Georgia. Kathleen is kind of out, it's a smaller town. It's outside of Warner Robins, so middle Georgia area. And the location in Kathleen serves youth from 10 to 17. Up until, I believe it was about 6 months ago, that was the age range for both of them. But we noticed that those kiddos in the transitional ages were having the kind of falling through the cracks. There wasn't really a good place for them to be served and treated appropriately. So we converted the Jonesboro home to serve youth with ASD from 18 to 21. And each home is overseen by a program manager. They have a BCBA, a registered nurse, as well as a case manager. And within the homes, each individually are staffed throughout the day and night with a licensed practical nurse, and registered behavioral techs and other direct support professionals. The program is designed to last for about 30 days. That is not by any means a hard stop. Essentially, what happens when an individual is admitted, the first thing will be, the BCBA will develop a crisis plan, and then they'll take the first about 10 days to observe the individual, to collect data, and then use that data to create their behavior support plan. And within that, of course, will be a number of goals to address their challenging behaviors. And once those goals are met and the caregivers have participated in training, then that individual will be ready for discharge. So 30 days is kind of an average, but it's not by any means a hard and fast rule. It just depends on how well the individual is progressing towards their goals. So some of the criteria for the crisis support homes, there must be a guardian of some sort, a stable guardian of some sort that would be willing to participate in our weekly treatment team meetings, as well as family training at the end of the program. We also, some additional criteria is autism needs to be the primary diagnosis. Sometimes we can serve individuals with dual diagnoses. It just depends on, what their challenging behaviors are and how they're manifesting at that time. But, if a child is having audio or visual hallucinations, other kind of psychotic features, it wouldn't be an appropriate program. They wouldn't be able to receive the appropriate treatment that they need for those symptoms in this program. So we can't do any of that sort of psychiatric stabilization, and we cannot handle any sort of medical management. Obviously, if a child comes in on medications, they will take those medications as prescribed, but we can't change the medication regimen. The individual also must meet an elopement assessment criteria. Now, we understand that elopement is a huge manifestation of in autism. A lot of kiddos and adults on the spectrum, exhibit that challenging behavior. So we want to accommodate that whenever possible. The only thing is you just have to understand that this home is it's a community home. It's in a neighborhood, just like any other neighborhood. And it doesn't have, according to the regulations, it doesn't have the ability to be locked down like a facility, like say Laurel Heights or another crisis stabilization unit or psychiatric residential treatment facility could be. The reason behind the elopement assessment is just to keep the individual safe. Their case manager is phenomenal. He will scour the region to find resources. If the child comes in without an ABA provider, they will leave with one. If they need other kind of, occupational therapy or even dialectical behavioral therapy in some cases, whatever services that the family is interested in and would benefit the child, the case manager will seek those out for them. So then we have our Autism Crisis Stabilization Unit. It is located in Rockdale County in Conyers. And this serves youth with ASD from 10 to 14 years. The main differences between the crisis home and the CSU is that kiddos with dual diagnoses, there's no question that they would be eligible for the CSU. They are set up in a way that can handle medication management. They can handle psychiatric stabilization. It's a different program that serves different needs. And it really is, I've been working with these individuals for quite some time now, and they are really fantastic at what they do. They'll work on activities of daily living, obviously work on their challenging behaviors that got them there. They'll work on adjusting medications if needed. The clinical staff, that they work on coping skills and strategies for emotional regulation. And they also include caregiver training. And, obviously the point of caregiver training for both programs is to have the successes that the child experiences in these facilities carry over once they return into their community, so the parents can or caregivers can, respond in a way has been shown to be effective for that individual, and hopefully keep them in the home from that point forward. So I did want to talk just very, very briefly about our waiver services. That is not my wheelhouse, but I, as a representative of DBHDD, I've learned a lot over these past 2 years, and I'm happy to share all the information that I have. There is a fantastic video posted on YouTube with a conversation between Rita Young, who is an independent consultant, and our Jeff Thompson, who's currently the regional coordinator for Region 3. But they did a wonderful talk on what it looks like to be eligible and pre-eligible for the waiver and what that process looks like. It's really very informative. And the link below that is the link directly to the application. So you can fill out the link to apply online, or you can contact your regional field office. If you are in the metro, I apologize for the dogs in the background. If you are in the metro Atlanta area, you're likely in Region 3, and that field office is on the Georgia Regional Campus in Decatur. But all of the contact information, the addresses, and phone numbers for the field offices are on the DBHDD website. And I would strongly recommend, no matter how old your child is, or the children of the families that you work with, how old they are, I highly recommend going ahead and applying for that waiver now. Even if, honestly, they are 5 years old and will not receive waiver funding for potentially 15, 20 years. Because these waivers are intended for adults, and they are based on most in need criteria. So, one of the common misconceptions is that once an individual turns 18, then they are entered into waiver services. And in an ideal world, when we had unlimited funding, that's exactly what would happen. But unfortunately, we have a planning list that we need to go by. So if your child is young, apply for the waiver. First of all, when it becomes time for that transitional age, when they're getting 16, 17, it's one thing that you don't have to worry about because it's done. But also, it will open you up for family support funding. So for individuals as young as 4 years old who are on the planning list, so that means that they've been determined to be pre-eligible for the waiver, they have access to a certain amount of funding every year for things like respite opportunities, for summer camps, for specialized medical equipment. I know I recently ran into a family who was getting a special needs car seat paid for by family support funding. So even, again, I really want to stress this, no matter how old the child is, if you think they will be eligible, go ahead and put in that application. So at the very least, you can have this access to funding and you can get some services while they're still young. And additionally, everybody on the planning list should be contacted annually. And if that's not happening, then please get in touch. If you or somebody that you know is on the planning list and they're not being contacted annually and they haven't been for over a year, please get in touch with the regional field office, because they need to be doing that to update any support assessments. They do nursing assessments, and that's really how the most in need criteria that's how it comes about on the planning list, are those annual assessments. So if an individual is, say, 19 and relatively fine, not a huge amount of challenging behaviors, they're okay living in their home, in their family home, but say, unfortunately, their caregiver passes away. So now there's nobody that can care for them. If they're already on the planning list, that would change their position on the planning list from wherever it is to, you know, 1, 2, or 3. I mean, really high up there, because they need it's become an urgent situation and they need that support. So get on the planning list is the moral of my story. And that's all I had for you. Here's my contact. If you want to scan that QR code with your phone, it'll give you everything. And there's my email address at the bottom.
Okay, now a couple questions came in. I know it's probably going to be hard to answer for some of them. You know, but what are the wait times for the waivers? I know you said it could be up to 15 years, but what about like the family support funds and all of that? And do the Katie Beckett waivers fall under this umbrella as well?
Katie Beckett is actually funded by the Department of Community Health, so that's not that wouldn't fall under this umbrella. And I don't have much information about Katie Beckett, unfortunately. As far as wait times, there is really no rational way to even give an estimate, because the thing about the planning list is, yes, there are, I think at last check, I hate to say this number, but there were probably over 7,000 individuals on the planning list. But a lot of them at this point wouldn't be eligible for services because they're younger and they're, receiving family support funding and other things like that. So they don't, people who are above 18 and on the planning list, I'm not sure what those numbers are, but it's, finding that timeline, unfortunately, is really hard to say.
Okay, and could you put your contact information back up for some people?
I'll just
they
put it in
weren't
the
able
chat.
to get. Okay, and then the link that you shared and that everyone will get a copy of goes to all of the waivers that you talked about?
The now waiver and the comp waiver, yes.
Okay. And the family support funding, how would someone go about getting that? They just apply through that link that you shared?
Yes, exactly. And I was planning on sending a PDF of my slides anyway, so you should all get these links, and just follow the link to the family support. And each individual county has their own provider, so the application goes to that provider, and it just depends on their procedures.
Okay. And if someone is on the planning list and their renewal was due back in March and no one had contacted them, what should they do?
They should call the field office. If they don't get an answer from the field office, they feel free to email me and I can connect them with somebody.
Okay. And would that be the same thing if someone was eligible for supports from 2021 to 2023, but they didn't get reimbursed through the family?
I would start with the family support provider first. So contact the provider, contact the field office, and no answers from there, please let me know and I'll see what I can do.
Okay. And to sign up for the planning list one last time, they just follow that link and fill out the application. So when we send those out after this it's not going to be immediately after, but after the presentation, they will have all the links that you need. Okay. Okay. Thank you very much. I think that's it. Again, you can continue to type in your questions, and after the next presentation, we'll go through anything that has not been answered already. Okay. And some of you have been putting in questions, like specific questions about what to do next and all that. Hopefully, as you go through these presentations, you will get that information. But if not, and you have a specific question, please put it back in. I have kind of marked them that we will answer these live later. But I want to make sure that you hear everybody before we start answering those and asking the questions, because someone coming up may answer your questions. Okay, thank you very much, Leah. That was very interesting. I don't know much about DBHDD, so I'm always interested to hear about it. And our next presenters, Dr. Nicole Hendricks and Dr. Catherine Picard. Dr. Nicole Hendricks is an assistant professor in the Department of Pediatrics at Emory University School of Medicine. She joined the Marcus Autism Center in 2019, where she conducts neurodevelopmental evaluations with children and adolescents referred that have features of autism spectrum disorder. She also provides parent-mediated interventions to promote social communication in young autistic children and those with other social communication delays, while overseeing an outpatient clinic centered on the use of evidence-based intervention, Project Impact, which she is going to be talking about tonight. Welcome, Dr. Hendricks. And joining her is Dr. Catherine Picard, who is also an assistant professor at Emory University School of Medicine, Department of Pediatrics, Division of Autism and Related Disabilities. She's also at the Marcus Autism Center, where she leads and collaborates on research examining mechanisms that foster the adoption, implementation, and sustainment of evidence-based practices within a variety of community systems, including early intervention and public school systems. She's interested in the role of families and community partnerships in shaping interventions as they're implemented within the community and in system-level factors that impact the reach and sustainability of translation efforts. She holds specific expertise in naturalistic developmental and behavioral principles known as NDBIs, and is a certified trainer in Project Impact, which is an evidence-based practice for young autistic children and their families. In addition to working with young children and their families, Dr. Picard also has expertise in cognitive behavior therapy for autistic youth and co-occurring anxiety. Welcome you both, and hope you have some time to talk about the peak, but if not, we may have to schedule that for another presentation because that is very interesting to me. So,
thank you so much for that fabulous introduction. And Michael, I appreciate the little tip off at the very beginning. So I did include a little bit of information about peak. But similar to the other panelists, we are just so thankful to have the opportunity to get to meet with such a large crew and to be alongside such fabulous panelists. So thank you so much for this opportunity. So as Michael had referenced, we're going to be talking a lot about the use of a specific intervention, Project Impact, with both Catherine and I have a lot of experience in. Within Georgia, we are going to start small, so talking about how we're using that intervention within the Marcus Autism Center, and then Catherine will talk about how the team is trying to increase access and supporting folks and being able to find some of these interventions. And really also excited to see that some of our team members are on the call as well. Let me see if I can move this out of the way. But as we're having these conversations tonight, and I also really appreciate when we're able to look in the chat, right, is that we understand that there are many pathways for support and connection within Georgia. Tonight, we've been able to hear from Synita about Babies Can't Wait. We think about special education. We think about community-based programming, just like Leah had recently talked about, outpatient clinics, specialty outpatient clinics. I'll be talking about specialty outpatient clinics tonight. But really importantly, we also think about the host of fabulous nonprofit organizations and family support services that exist across the state of Georgia. And we also think about how that can be so hard for families, especially at a very early point when they might be first noticing that their child's learning differently. How do we help parents at this point start to understand the landscape and be able to start to ask the questions that help them move forward? And so Michael had referenced a community advisory board that he's actually a part of as well. And so we're Partnerships for Empowerment, Autistic Acceptance and Knowledge, or PEAK, and it's a group of autistic self-advocates, researchers, providers, parents, and community leaders who are really focused on just wanting greater access, understanding, and acceptance for autistic children and their families with a focus on the Metro Atlanta area. And a resource that we've been working on and will be launched within later in July is trying to pull together some of these resources. And as folks are dropping some of their organizations within the chat, I've also been furiously writing them down to add them to the website this evening, but also helping parents to start to think of how do we navigate some of these resources? How do we find good information when we're starting to ask some of those questions? So that's what our resources focused on, but to connect families with other families and other resources that are already existing and providing lots of families in Georgia supports. So just to reference, it'll be coming soon. So if the slides do happen to go out a little bit later than folks might want, then we might be able to provide that website at that point. But if not, then we'll be sharing it out with anyone who is on the AAC listserv. But tonight, what we're going to be discussing is how one parent coaching intervention has been included across several settings in recent years. And so this is Project Impact. I'll be giving a little bit of a background of what Project Impact is, and then we'll talk through how it's being implemented, so how it's being used, and Catherine will talk about the many different avenues that it's being used across the state right now. So just to provide folks with a little bit of a background, within the introductions, you might have heard terms like naturalistic developmental behavioral interventions, or NDBIs, right? Another acronym soup. But the key idea there is that it's blending together best practices or things that we know really support young children, especially young children with social communication delays, including autism, of how do we help parents learn how to pull their children in and have a very meaningful reciprocal interaction, which pulls from developmental science. Blending those with applied behavior analysis or naturalistic behavioral interventions. So those that are based in ABA, but then can be embedded within day-to-day routines, right? So how do we capitalize or leverage what a child is most motivated by, pull those in to make sure that learning opportunities are occurring within the context of that, which crashes together to make these NDBIs. So again, the idea is to pull from these different fields of literature to find the best supports for really young kids, and also how do we support parents in being able to use these interventions. Many of these interventions are really thinking about the crashing together of social engagement, or how we interact, how we hang with one another with communication. Both of these are very common areas where parents are looking for support whenever their children are, for example, under the age of 5 years old. And their children might go on to be autistic, or they might have other social communication delays. So it's really focused on using some of these therapeutic approaches to help boost both of these areas for children so that they're able to access the lives that are going to be most meaningful for them. There are lots of different programs that use these different types of approaches. We included a list here of some of these evidence-based programs. So some of these programs that have really strong research support. Even though we'll be focused just on one, we do like to reference that there are other programs to pull from. But tonight we'll be talking about Project Impact. And Project Impact, the core reason why we were interested in, for different reasons at different times, of using this particular intervention is because it's not just focused on using these types of approaches to help kids build these skills. Perhaps even more importantly, it's focused on how do we support parents and empower parents to be able to use these strategies. So the goal not being for a parent to take the role as a therapist, but really just so that a parent understands how to use some of these approaches to build an even stronger relationship with their child, and to also see that they can support their child in building skills in these different areas. The Project Impact program also is very focused on collaborative goal setting. So making sure that the goals that we set within the intervention are very closely linked or tied directly to what the family wants and what the child potentially wants for themselves moving forward. And so, as I mentioned before, it's to support the use of those NDBIs, but really within that framework of a parent coaching model. And also why we've been interested in it across different settings is because it can be quite flexible, and thinking about how it looks. Is it going to be a group of families? Is it going to be one-on-one? Is it going to be a shorter number of appointments, or could it be a longer number of appointments depending on the context and the need? And so tonight, what I'll be really focused on is taking a more narrow approach of how Project Impact is being used in one of those specialty outpatient clinics. So as I mentioned, A part of the Marcus Autism Center is the Early Intervention Clinic, and our goal really is to empower parents to support early social communication, primarily using Project Impact. We are very fortunate to have very skilled and fabulous clinicians on our team who have expertises in other areas and will adapt as needed to meet families' needs. Within our model, we meet one-on-one with families. And so a speech language pathologist or a psychologist, everyone is certified in using the program, meets one-on-one with a family, teaching them how to crash together these different types of strategies to support learning in the home. The type of service that we use does go through insurance, so it's a billable service across Medicaid, CMOs, commercial payers, within a relatively short time frame. The goal being that within this clinic, we want to support families in transitioning to longer term supports. So similar to the idea of PEAK is that we want to help families be connecting to all the fabulous supports like those that were discussed by the panelists earlier, and also the different organizations that are being dropped in the chat. So we want to empower families with strategies, but we also want to support families in understanding how do they get support and how do they help themselves moving forward within a really complex and oftentimes confusing landscape. Within our service, we're oftentimes thinking about not just working with the parent or the caregiver and the child, but also pulling in other caregivers, other siblings, because that's home. And we want to make sure that everyone can be included in the intervention. Our services include opportunities to be seen by a Spanish or a Spanish bilingual clinician, and then telehealth or in person, depending on family preference. So who do we see? Even though I reference being at the Marcus Autism Center, I want to be really clear, and this will come out even more as Catherine's speaking about Project Impact in the community, is that the goal is not just to see children who have a diagnosis of autism. I think everyone on this call is very acutely aware that there are many barriers for a child, for an adult to receive an autism diagnosis related to structural disparities, complex landscapes, all these different pieces. And so we have no expectation that a child has an autism diagnosis for those being seen within our clinic. And that's a similar expectation for Project Impact being used in other settings. And so within our clinic setting, 55% of children are referred from an autism diagnostics clinic within Children's Healthcare of Atlanta. And that's about the number of children who have a formal autism diagnosis. Another quarter of the children being referred are from NICU follow-up or neurology specialty clinics. And so do not necessarily have an autism diagnosis, but have identified genetic conditions or suspected genetic conditions, cerebral palsy, a host of other concerns that might be impacting their social communication as well. And then we also have a close relationship with the Hughes Spalding Primary Care Clinic or from external providers in the community, primary care providers, where the child might be autistic, but we're not at that point where the child has been able to access an evaluation yet. And we tend to see kids between the ages of 15 and 48 months, with most of our kids being close to 3 years of age. In thinking about what the clinic has been able to accomplish over the past 4 years that we've been in action, we've grown pretty quickly. And it's been great to see how we're able to support families, with the goal being that this year we'd be seeing between 350 and 400 new families. But we're always thinking about how do we improve and move forward. A constant conversation within our team, and it's also related to a lot of the research that's been conducted within this team and led by Dr. Bricard, is how do we continually improve how we're providing culturally responsive care, especially thinking about for our Spanish-speaking families. How do we support families in navigating financial and resource barriers, especially just given the high level of need that a lot of our families are experiencing, while we're also supporting them and using some of these intervention strategies to support their children in learning. And so we are always thinking about how we're going to improve our service line. But really importantly, this is just one small percentage of the many families in Georgia who would benefit from best practices in parent coaching. And so as we move forward, I'll be able to drop information in the chat about how to refer to this specific clinic, but this is just one possible pathway, whereas Catherine's going to be speaking about some of the larger ways of thinking about access.
Thanks so much. I know my husband got home just in the nick of time. I'm gonna share my screen. I think that's a really nice segue to be thinking a little bit about, like Nicole mentioned, how do we build community capacity to really effectively serve either autistic kids or kids who have other social communication differences. And I want to say that the reason, so my background is I'm also a psychologist, but I got into this work because, like has been kind of people have been alluding to in the chat and has come up in all of the talks today, it's super hard to access care. And so during the time that I was in grad school and postdoc, I kept thinking, like, how is it that we improve access to care, not just in specialty clinics, but in our own communities? And what does that mean? Where is that? Who's being missed? And thinking more strategically about that. So I'm going to talk a little bit about the work that we're doing in this area. I want to give acknowledgments. I don't know why the lines are kind of staggered here, but to a really large team at the Marcus Autism Center that's been thinking about how to improve access to care. We are not creatively called the Access Lab at all. And our goals are to examine and address structural and systemic barriers to quality care delivery. So thinking about why the heck is it so hard to get the good quality stuff in the community? And really then with that information in mind, think through how can we help systems implement early intervention and mental health services in community settings so that kids and families can access them easier. And then, like Nicole just mentioned, to think through how do we increase the cultural responsiveness and the flexibility of the services that we do have available. So how the heck do we do this, right? I think everyone knows easier said than done. If this is an easy problem, we wouldn't be here tonight talking about it. And it's not okay just to take, some of the best practices that we know and shove them down communities, because that is not appropriate either. And so how we do this is we think about two things, and I'm going to give a couple of examples here in a second. But the work we do is really grounded in implementation science, which is just a fancy way of saying that we're really interested in studying the strategies, right? The things that help people. And when I say people, usually I'm talking about community providers and systems. We're studying strategies that help them adopt and use evidence-based health interventions in community settings so that it's easier for patients to access care and easier for kids to have kind of good quality care. So we're thinking about doing this as scientifically as we can. And the work that we're doing is grounded in community engagement. And I think that goes without saying, right? Like, you can do none of this work well if there are not formal collaborative partnerships between researchers and community members, in which we're really thinking about sharing expertise and working towards a common goal. So the group that Nicole mentioned earlier and that Michael is part of is one example of a community board, but we're also super fortunate to get to work with Synita Griswell and the Department of Public Health and Babies Can't Wait, Atlanta Public Schools, and a number of kind of community nonprofits and ABA organizations. So where do we focus, right? So we've talked about services at Marcus, and then it's like, well, where else? Well, good news, right, is there are lots of other places to be thinking about. And we're often thinking about, where do kids and families naturally access services? They're going to access them in Part C early intervention, right? And Babies Can't Wait. They're going to access them through nonprofits. They're going to access them through public schools and through, this says ABA clinics, but we could talk about any number of outpatient setting, whether that be speech therapy, occupational therapy, et cetera. So I'm going to talk about just a couple of different projects. We have a number that are going on in this area, and at the end of the slide, there's a QR code that can take you to a link that talks through more of the work that we're doing. But I'm going to talk about first some work that we're doing in Babies Can't Wait that Synita alluded to, and then I'm going to shift and talk a little bit about some work that we have that is focusing on ABA organizations, which we haven't talked a ton about, but I think is a really important service setting. So what are we teaching and hoping that community providers do in our Babies Can't Wait system? Like Nicole mentioned, there are lots of best practices. Our team focuses on building providers, Babies Can't Wait providers, efficacy delivering project impact. And we focus on this program for a couple, probably not a couple, more than a couple reasons. One is that it is considered an evidence-based practice. It's used, our team holds a lot of expertise in it. It's a parent coaching model, and it's really designed for parents. All right. And I think it comes with a nice roadmap that really kind of helps empower families to know, gosh, if I want to help my kiddo communicate and use new skills, what are the different strategies I use and when? And so again, and it's not autism specific necessarily. So what have we been up to? So we have been fortunate to be kind of in a piloting-ish phase, although we've kind of transitioned into more full-blown training in Project Impact and Babies Can't Wait for about 3 years now. We started in formally training at the end of 2021. And we can say that we've had about 70 providers who have kind of gone through that training across lots of different health districts. And we're able to collect some data to show that the providers in the community who are trained in Project Impact double their self-efficacy delivering the program, so they feel more confident doing it. They increase the quality of their services by about 25%. And so again, we want to be able to show the impact of our work and show that, you know, it's not just one thing to kind of like make people feel more confident, but we actually want to see shifts in the quality of care in the community. And so this, I think, is a really important statistics. We do our best to track, so how many families are then impacted, right, by this work. And so we are able to see that in about the 6 months after a provider is trained in Project Impact, they deliver it to, on average, at least 10 families, right? And so we can kind of, you know, again, there's some variability in that, but we're able to then take that number and understand, okay, if providers on average are seeing 10 families a month in Project Impact, how does that kind of compound over time? And so we're thinking about, and again, there are lots of ways we can track this information more systematically, but we're thinking about 200 to 300 children are now able to receive Project Impact about every 6 months in the system. And so that's huge, right? You know, to Nicole's point, like we are thinking about ways that we can not just, you know, we don't want families to rely solely on coming to places like Marcus for services, although it's really, that is great too, right? If families can access it, we want them to be also able to access it in their own systems. And then I think importantly, like a little bit bigger than the early intervention program at Marcus, about 70% of the kids who access Project Impact and Babies Can't Wait don't yet have autism or have an autism diagnosis, right? They might be on the journey, maybe they're on an extremely long wait list, right? Maybe they're about to get diagnosed, but most of them don't have autism yet. So where are we headed, right? Like, this is great, but like 70 providers, that's like when we think about the scope of Babies Can't Wait, is a relatively small number. And so over the next few years, our goal is to really develop in partnership with the system, some strategies to help more providers use Project Impact, incentivization strategies, if you will, to build up networks just to make sure that providers are able to sustain their use of Project Impact, and really to leverage the electronic health record in Babies Can't Wait to understand kind of who's delivering the program and its impact. All right, and this will get sent around after. This is just a flyer to depict that we will be hosting a training in Babies Can't Wait for providers in Project Impact. This will be at the very start of 2025, but if you know providers and Babies Can't Wait or are interested in learning more about this training initiative, you're able to scan this QR code, take the flyer, and share it. And I just want to end quickly by talking, I mean, we talk a lot about our work in Babies Can't Wait, and it is super important. But I just want to highlight that it's not the only system that we focus on. We also focus on some efforts to improve the quality of community-based ABA services. And so, as many people on this call likely know, ABA interventions are often cited as the gold standard for autistic kids, right? You get a diagnostic evaluation, and one of the lines in the report that you get likely recommends ABA services. At least 50% of autistic kids receive ABA therapy at some point during their early childhood. And once accessed, most of the time kids are accessing a lot, right? It's not like they're just going to ABA for 1 hour a week, they're going for many hours a week. And it can be hard as a family to navigate, well, like, is this a good fit for my kiddo? Like, how do I know if the ABA services I'm getting are good quality? And to navigate some of those decisions. Over this chart here just depicts the expansion of ABA insurance coverage over the last several years. And as you all know and have likely seen, there's been a huge expansion of ABA in response to insurance mandates that now require the coverage of ABA for autistic kids across most US states. And it's really driven this like massive proliferation of ABA practices. And so just some fun stats, in the US, there are about 68,000 BCBAs and about 168,000 RBTs. But right, there's huge variability in the quality of ABA care, and this is tricky to navigate. So ABA is an umbrella, and I think that's super important to understand. It's a framework for delivering intervention. And ABA interventions lie on a continuum from very structured, compliance-focused intervention to those that Nicole has alluded to that are more naturalistic, right? We're teaching within the context of play. We're really following kids' lead and using their natural motivations to teach them, relevant and important skills. And so, again, it's actually not that clear cut, right? It is a continuum. It's not one or the other, but this is generally how we think about that. So some of the work that we've done recently, I'm actually not going to show that because that's right this second, because that's a little overwhelming and there's a lot of text, but some of the work we've done recently has focused on partnering with various community ABA practices to understand what is it going to take to do more naturalistic and more developmental high quality ABA in the community, right? So to do less compliance focused intervention and more naturalistic intervention, right? And that can be a tricky shift to make. And so we've been able to learn some really, I think, interesting things, but that we really need to understand the complexity of our systems before we just dump interventions in them, right? And so we need to understand what it's going to take to do NDBI in a context where it actually is kind of hard to do lots of training. And then some other things just to be thinking about are that ABA organizations who are, wanting to implement or train their providers in NDBIs or things like Project Impact. Also, we're thinking about also the importance of also unlearning and stopping using things that may be less appropriate for toddlers. And there's all sorts of things that get in the way of doing high quality care in ABA settings, including providers maybe not having the background and things like Project Impact, maybe viewing some of these things as a fad or not something that's going to be kind of sustained over time, or thinking that these are hard interventions to do, and that can all make it tricky to train. So what are some of the things that we're working on right now in ABA settings? We're in the process right now of getting ready to do more training in NDBI in ABA organizations across multiple states, but Atlanta being one of them, and really understanding kind of what it is going to take to use higher quality care on a larger scale. That was just again, a brief kind of overview of some of the projects that we have going on. I'm just going to drop this last slide has a QR code that will take you to a website for our team that talks through these projects in more detail with like various infographics and summaries of some of the work we're doing. You're also welcome to reach out, and we're happy to kind of talk more about some of these community initiatives.
Okay, thank you both. That was very interesting to hear what Marcus is doing overall. A couple of questions that came through. One is, does Marcus actually run intensive summer camps that you know of?
I don't know of, and actually Dr. Nuhu might be able to speak to this better too. She's on the call somewhere too. But not that I know of. I know that there are summer camps, short-term ones, like Camp UBU offered in this.
Okay. And then for Project Impact, could a 5-year-old that was diagnosed from the community provider, a community psychologist, get access to Project Impact, or does it have to be someone coming from a Marcus diagnosis?
That's a really good question. Hopefully these types of interventions can be, they're just increasing access. For us within the Marcus Autism Center, it's not based on where the diagnosis comes from, but we have an administrative structure of that we're able to see kids under the age of 4. So unfortunately, we're not able to see kids over that age, but that doesn't mean that NDVIs are not appropriate for kids at that age.
Okay. And then do you guys know the timelines at Marcus from when a kid gets an evaluation to when they can start services like Project Impact or any of the other services at Marcus?
I can't speak for all the services, and I saw that Ellen Parham had put information in the chat about diagnostic timeline. When we're able to get a referral, and there's some complexity around that, I'm happy to speak offline with folks about that. We are able to move within a shorter time frame of a few months from folks being referred to our program to being seen. But that can be a complex process, and I'm happy to speak with folks about that.
Okay. I think those are all the specific questions for you. Just some other for everybody, and kind of any of you can answer these. Kind of a big one that's been going through is all this information is great. You know, kids are have access to lots of services. But what about kids that didn't have access to these services, or kind of like fell through the cracks, or COVID interrupted services and they got diagnosed at 3, COVID happened and now they're 7.5. What are we as different agencies doing to kind of help these kids that fell through the cracks? Or do we have any thoughts on that? And that's really for anybody. It's not geared specifically for at Marcus.
Yeah, I think that's a really good question. I mean, I think inevitably that is, that's the experience of multiple families. I think I guess my first thought is, how are we effectively partnering with our systems that are able to serve these kiddos? So that means, how are we training school teams, right, to support kids, knowing that most kids are in schools and accessing services in schools, and thinking about kind of ABA providers as well, who are often also serving kids up through that age range. Yeah, ideally we're not missing kids, and they're not accessing services for the first time at 7, but some do. And so just thinking through kind of where we can build capacity.
And just to add a little to that, I think that, or maybe completely, sorry about my child in the background crying. But I think one thing that's really important to consider is that it's never too late to start, right? So like getting a late start does not mean that you won't be able to make progress. It may not look the same at the end, but you will still be able to make gains. You will still be able to accomplish some of the goals that you have for your child or for someone that you care about. Just kind of get out there, get the diagnosis that you can, get the services that you can, get the waivers that you can to help support that. I think parents sometimes feel discouraged when their child is a little bit older and that they missed out on an opportunity. It is important to start as early as you can, but as early as you can is when you should be getting started. So try to get out there, get connected, send organizations an email. People usually are so friendly in the autism community to be able to say, oh, well, this may not be my job, but I can direct you to this person that can maybe help connect you a little bit better. So yeah, just a little plug to try to get involved when you should be.
Yes, thank you for that plug, which kind of leads to questions that have kind of been going through is where would this presentation has really been concentrated on young kids, except for some of the work that DBHDD's been doing with their crisis work with the older kids. But where can parents find information about interventions for preteens, teens, adults, kids over the 0 to 5 age range that a lot of these interventions we talked about have been focusing on? Do you guys have any good hints or suggestions for families or for providers to give families for that?
One resource I would encourage people to look into, and this is maybe even better for like adolescent age and up, or young adults, is the Emory Autism Center. They have a lot of programming there, and they have a lot of connections to the community that is focused on older individuals that are autistic. So I would look into their website or reaching out to someone at the Emory Autism Center as a place to start. Unfortunately, I don't know of many others, but I think that is one that I've heard families talk great about. Sorry again about.
Yeah. And thank you for that. I was going to mention the Emory Autism Center, but since I used to work there, I didn't want to seem like I was self-promoting it. But I will say, they do serve individuals on the autism spectrum, basically birth through death, all ages, adults. They're one of the few programs in Georgia that actually work with adults in some kind of intense services. So really go to their website, and they have an intake form that can get you contacted to the programs there as well. So, and that's for all ages again. And then someone was asking, and we may not have questions for this or an answer for this question, but can you think of any funding or support for agencies or a nonprofit organization that's trying to assist families with support at the local level that really are kind of out there on their own? How can they kind of help support, or anything that they can do to help get some of this, some funding to help them that you know of? And can any of your agencies help with that? I know that's a hard question. Okay, doesn't look like anyone really has an answer for that, but we will be, I would stay tuned. There may be some resources available through the AAC, so keep up with their website and see what's going on as well. We are getting close to our time, and so I didn't get through everyone's questions, but I tried to kind of summarize some of them here at the end there. I want to thank you all. This was great information, and I think it's really helpful. It's stuff we can actually start using tomorrow when we get up, or tonight if you work all night, but tomorrow morning, and start boots on the ground and really helping. So thank you all for this.
Wait, to interrupt. Can I make a quick suggestion?
Yes.
So the Parent to Parent of Georgia, they're a fantastic organization that do a lot in terms of support groups, but they also operate the special needs database. And it is just a wonderful resource for, anything from ABA providers, dentists, doctors, and you can search by location, you can search by age. It's, I think, really helpful. I've heard from a lot of families that it's been very helpful for them.
And there is someone on this call, Amanda Scott, who is a contact at Parent to Parent, and she put her email in the chat, to reach out to get information. And pretty soon, by the end of July, I'm guessing, the website with the resources that the Peak Group has gathered will be available too. So, there'll be some other places you can look for some of these resources as well. So thank you all. And again, we will send out to the email that was registered to all the information that was discussed. It won't be, tomorrow, but, within the next couple of days, we'll get out the slides that have all the links and the QR codes and the contact information if you want to contact anyone individually for that. And thank you all for coming, and thank you all for the panel. It was excellent. Thank you.